Hey guys, and welcome back to Confessions of a Doctorholic. It's your girl, Dr. Slavin, or Hafsa. And today's confession is about the moment I realized maybe hernia surgery isn't exactly as glamorous as I imagined. I know, no. Hernias are supposed to be this super satisfying fix-it surgery. And honestly, that's why I picked surgery in the first place. You find a problem, you fix it, boom, done. Until it gets messy. So we had this patient with a chronic mesh infection. He had a little drainage going on, which isn't totally unusual. Chronic infections tend to just hang out. They're not always dramatic. But this guy, he'd had this mess for ages, and it was starting to become a real issue. So we took him to theater. We started dissecting around the mesh, trying to remove it. It's one of those frustrating cases where everything is stuck, like Velcro. And sure enough, the mesh is adhered to the bowel. And then his intestines move. Not in the normal peristalsis way. I mean, like, things open up. And suddenly we're not just removing mesh anymore. We're in fistula territory. And before we even process what's happening, there's a smell. A very specific smell. And then, I kid you not, green peas start popping out. Literally, green peas. I wish I could say I held it together like a seasoned surgeon, but no, I was traumatized. It wasn't just the smell, it was just the entire situation. The mess, the green peas, knowing where everything is. Like, it was just so gross. And that mental image has permanently ruined green peas for me. Like, I can't look at them now. Every time I see peas on a plate, I'm instantly transported back to that OR. The adhesions, the drainage, the smell, the peas. Goodbye, green peas. It's been real. And the wildest part? This isn't a rare scenario. When you have a chronic mesh infection, you can end up with something called a fistula tract. Basically, an abnormal connection between the bowel and the skin or other tissue. But you can't go in and fix it right away. You actually have to wait for it to mature into a proper tract before you can do a formal bowel resection and remove it safely. So these patients end up with multiple surgeries, long hospital stays, and a lot of complications. And I'm not even joking, for months on end, like 3 or so months, they're made NPO, so they're not allowed to eat anything by mouth. And we just give them TPN so that tract doesn't get any larger. Now here's where it gets even better, because misery loves company, right? So I'm debriefing one of my co-residents and he goes, "Oh my God, that reminds me of my green pea trauma." Apparently on his second day as an intern, they were called to check out a patient's ostomy because something looked weird in the bag. The nurse hands him a Starbucks bag. Yeah, literally, a Starbucks bag that had been used to collect the output. Inside, something long, slimy, disturbing. They thought it was a parasite. They even told the patient, "We may need to send this to pathology to confirm what it is." And guess what it was? You guessed it, green peas. I wish I was making this up, but no, this is medicine. This is the glamorous, guts and glory side of surgery no one warns you about. So yeah, hernia cases are still fascinating, still flexible. So yeah, hernia cases, still fascinating, still flexible. But this case, absolutely ruined peas for me. And someone please get me off the hospital dessert trays because I've officially developed a post-op cookie addiction. Thanks. So that's today's confession. A hernia case, a bowel fistula, and a vegetable I can no longer trust. Thanks for listening to Confessions of a Doctorholic. Until next time, stay scrubbed, stay curious, and maybe pass off the peas.